expressed on this program are not those of intellectualradio.com, its subsidiaries, or sponsors. Encouraging, educating, and empowering you into action. This is Warriors Talk with your host, Lady ReShell.
Hello. Welcome to Warriors Talk with author and founder Lady ReShell, where we move away from awareness towards action. It is Health and Wellness Monday, and our topic for today is heart disease prevention. We are live on Intellectual Radio. We just heard from the Drive at 5 with Roman. Keep it locked right here on Intellectual Radio and allow us to feed your brain. On the last episode of Warriors Talk, Rosal and I discussed unrealistic expectations about love. Go over to YouTube, type in Intellectual Radio, and stay connected for any episodes you may have missed. The quote of the day is, above all else, guard your heart, for everything you do flows from it. Here are your trending topics for today, and we are still celebrating Black History Month. So today we are honoring Daniel Hale Williams. In July of 1893, James Cornish was admitted to the Chicago Providence Hospital with a knife wound to his chest stemming from a barroom brawl. He needed surgery, but medical professionals at that time believed that operating on the heart was too dangerous. That was about to change without antibiotics, adequate anesthesia, or many of the other tools used in modern day heart surgery. Dr. Daniel Hale Williams cut a small hole in Cornish's chest using a scalpel. He then repaired a severed artery and a tear in his sac surrounding the heart. Cornish lived another 20 years following that operation, and Williams became known as the one of the first doctors in the world to perform a successful open heart surgery. Those are your trending topics for today. I am so grateful for my sponsor, Emanuel C.O.G.I.C with Pastor Michael Richardson, who has a special message for us.
Greetings, I am Pastor Michael Richardson.
And I am First Lady Anastasia Richardson from the Emanuel Church of God in Christ. We're located at 3058 West Van Buren in Chicago, Illinois. We are building upon a solid foundation.
And we're inviting you to join us every Sunday morning on Facebook Live at Emanuel C.O.G.I.C at 10:15 Central Standard Time. And you can also view our videos on our YouTube channel at Emanuel C.O.G.I.C.
I am so grateful for my sponsor on today. You guys can visit Emanuel Church of God in Christ, located at 3058 West Van Buren in Chicago. And they are having services on Facebook actually at 10:20, but you can join them live at 10 a.m. on Sunday morning. You are guaranteed to leave there actually fed. I've been going there for 10 years now. And they have been sponsoring the show, I want to say, since the very beginning of the show. So I am grateful for them. I'm also grateful for one of my sponsors who is retiring. She actually sold her Allstate agency, and she is in her retirement age right now. She's celebrating life. She just got married. And so Paula Kelly with Allstate, I just want to thank her for just believing in Warriors Talk and sponsoring us over the last 6 years faithfully. And I just want to wish her well in her retirement. All right, you guys, I am so grateful for the show on today. The news that we're going to give out, the facts, the information is guaranteed to save your life. And we have none other than who is no stranger to Warriors Talk. She is our resident expert who has over 20 years experience as a physician. And guess what she's doing? She's impacting lives every day. Doc Michelle, what's going on?
Hello, Lady ReShell. Great to be with you again, as always.
I'm so excited about the topic today. Not only is it the love month, you know, we think about chocolates, we think about flowers, we think about candlelight dinners, but you know what? February is not just about Love Month, but it's also about American Heart Month. And we want to make sure that we here on Warriors Talk is giving you facts to help you make better lifestyle choices that are guaranteed to save your life.
Yes, yes. And this topic in particular, is very close to my heart. Speaking of, my mother, who passed last year, was diagnosed with heart disease back in 2013 and had triple bypass. And did very well, for 9 years after that. You were talking about Daniel Hale doing that surgery, the first surgery, and did very well for 9 years, and then passed last year. So it's close to my heart. I kind of continue to educate in her name as well, because it's not. We want you to know your risks. We want you to get the right treatment, but we want to catch heart disease before it happens, right? So you don't have to live with the sequela of that, for your lifetime.
And we know that, according to statistics, heart disease is the #1 killer in the US, but also worldwide. So this let you know the urgency when it comes to knowing this information about heart disease and knowing what it is that you can do when it relates to it. So all is not lost. It's not like, oh, this is a defeated case. If I get heart disease, I'm just going to have to deal with it. No, you do have some things that you can do, that you can control. So let's just start from the beginning, because some people may not know, Dr. Michelle, exactly what heart disease is. We know it has something to do with the heart, but what exactly is heart disease?
Yeah, and that's a good place to start, right? Because like you said, it's the most common leading cause of death. People are dying daily from this disease, and so it's important to educate yourself. So what are we talking about, right? Because we hear about this all the time, and there's different types of heart disease. There is, when we think about a heart attack, right? That is really when we're talking about something that impacts the blood flow to the heart muscle, right? And that can come from different causes. One of the causes is high blood pressure, right? When the pressure is high in your arteries, the blood can't get to your heart effectively, and that can cause a heart attack, right? So it's anything that causes heart disease in a general term, anything that causes your heart to not function normally, right? It's under the umbrella of cardiovascular disease, but there's different conditions that affect it, right? So one is that high blood pressure. How is the heart able to get its blood supply? How is the heart able to supply blood to the rest of the body, right? And so we think about heart attack is one form. We talk about the arrhythmias, which is like atrial fibrillation, where your heart's not beating normally, but it's going like this. And then if it's doing that, fibrillating, it can't pump the blood to the rest of the body effectively. We talk about angina. So angina is really that chest pain that people talk about, right? And it's caused by a lack of blood supply to the heart. And there's heart failure, right? So when we talk about coronary artery disease, that is blockages in the arteries. When we talk about heart failure, we're talking about how well can the heart pump the blood forward, right? When people have heart failure, that heart becomes enlarged. The heart should be the size of a fist sitting in your chest, but people have large global hearts. And unlike our regular muscles, when our muscles get big, they work better. When the heart muscle gets big, it works poorer, right? So you get a big heart with a floppy muscle that is not working and pumping the blood. And that's part of heart failure. Multiple reasons, diseases that cause that over time. From infections can cause heart failure. People can have bad infections that can cause it, from high blood pressure over time, from other birth defects even can cause that. So there's different things that lead to heart failure. Some of them we can prevent, some we can't, right? So the genetics, the family history, which we always talk about family history, is that genetics or is it environmental? we're all sort of doing the same bad activities that causes that disease to run in the family. Age, and of course, men can be more at risk for heart disease. So some things you can't change, but there's a lot that we can.
Okay, so that was where we were going next. Like, what are some of those risk factors that we can't do anything about, that we just have to deal with because either we were born with it or we're aging, or
Yeah.
it's something that's within our family, a family history?
Right. Yeah. So the age part is, we know as we get older, the heart, the blood vessels in general can get stiffer. So we're sort of more at risk to develop high blood pressure as we get older. Doesn't mean it's going to happen, right? But that risk does increase. Then if you add other risks on top of that, right? The things we can't control. But age for sure, as we get older, we're more at risk for heart disease, men more than women, family history. Of course, there are some genetic causes for heart disease. But then again, when I think about family history, I'm not just thinking genetics, I'm thinking about what are we all sort of environmentally exposed to that could be doing that.
That makes sense. I think sometimes people kind of think when you talk about family history, they're thinking about something that's being passed down genetically from a parent. But if we're all living in the same environment, we're all eating the same foods, we all are under the same stress, the experience, or inhaling the same environmental chemicals or whatever, then we all can have the same type of issues when it comes to our health.
Right, exactly. And so it kind of leads from what are the things you think you cannot change to what are the things that you really can impact that can affect your heart and your heart's ability to do its job effectively, right? There are certain things we just, we're all going to get older, God willing, we're all, whatever sex we are, but there are things that you can do to decrease your risk. And one of the things I always start with is really, if you're a smoker, stop smoking, right? Because we know that when you smoke, that causes inflammation in the blood vessels. It can cause decreased blood flow to the heart. And so quitting smoking is one of the best things I always tell people to do, because even it doesn't really matter how long you smoked, how much you smoked, but once you stop smoking, you begin to decrease your risk of heart disease. And I was reading that if after you go about a year without cigarettes, the risk of your heart disease drops about half that of a smoker.
I,
So the
I feel
minute
like,
you stop.
not to cut you off, but I feel like that alone is a motivator right there. It's like all you have to do, and I'm not saying that quitting smoking is so easy, because I know it's addictive, and it takes a process for you to stop smoking. But just think about how you can improve when it comes to heart disease. I mean, all you have to do is just stop smoking, and
Yeah.
automatically your chances of getting heart disease improve. My dad, they told him over, God, 25 years ago, stop smoking. The doctor told him stop smoking, and he tried with the gum, he tried, all different types of things, but he just couldn't. He would always resort back to the cigarettes, and eventually he ended up getting lung cancer. But just imagine when the doctor told him over 25 years ago, hey, we see a spot on your lungs, you might want to stop smoking. And just imagine where he probably would have been if he had stopped altogether.
Right. Yeah. And it's hard. I know I've counseled many patients to, on quitting and the benefits of quitting. And we just continue to have the, first of all, the dialogue about it, right? If you are a smoker, I always tell, my colleagues and nurses I work with, nurse practitioners, when we have the conversation about smoking with someone, it's not a one-time conversation. We're going to continue to ask, but then we also want to know, what is the hardest part that you find about quitting? What's the hardest part? And then we want to know if you've tried to quit before, what worked and what didn't. And starting small. Now, some people are able to go cold turkey when they quit, but some people need to do it piece by piece. And I will usually ask, well, what if during the day, where's the one place in that day you think you could give up the cigarette, right? So we want to start with, what do you think is would be the easiest time to give that up? And let's work with that time, right? Let's work with, maybe it's, I don't know, after you eat dinner or in the drive home, but where do you think you could start? And usually if you start there and you get some success, you can keep going. And then there's all the tools we have. We do have medications, we have gum, we have patches. All those things have been shown to help people quit. But if you're out there and you're listening and you know someone who's tried to quit, or if you're a smoker, encourage them to keep at it, to talk to their doctor about it, because there are apps, there's medicines, there's so many things, because we know it's one of the most important parts of your health, that we have more tools in the toolbox to help you. And it's expensive too, right? To
It sure
smoke.
is.
So it is. So all those things, I just encourage you out there to talk to your provider, think about all the tools we have. If you've tried before and it didn't work, stick with it, try again.
Try again. What are some of the other risk factors that we can control?
Right. So we know that obesity and being overweight, which comes from being inactive, right? So if you are even overweight and have a BMI over 25, or obese, which is a BMI over 30 and 40, is morbid obesity, you're at risk for heart disease, because that puts you at risk for the other things like diabetes, like high blood pressure, right? And the one thing that we recommend is 150 minutes a week of exercise. So easy to say, but how do you break that down? When I'm talking to patients, I just tell them to get moving, right? If you've done nothing, and now after the pandemic, we're sitting all day, me included, it's hard to get moving. But yes, we can talk about, I want you to get 150 minutes a week of moderate exercise, which turns out to be about 30 minutes, 5 days a week, right? Or if you do an hour, 3 days a week. But sometimes that's hard to start with. So I just say, hey, get up and move, do a walk around the block. If you sit all day, make sure, put something on your phone or your watch that says every hour you're going to get up and you're going to go and walk around the house, or you're going to go outside and walk, because even that type of activity has been shown to be helpful. You don't have to get all your 30 minutes at once, your whole hour at once. We know that if you are active, gardening, walking around the block, dancing, I mean, whatever that is for you, to be active can do wonders and help to lower your blood pressure and your weight.
Yeah, I really think, it has a lot to do with that consistency. Like, even if you don't want to do it, you just kind of like push yourself to do it. And before you know it, you got 3 months under your belt of consistently going to exercise, and you begin to feel some of those things in your body. You begin to say, oh, wow, it's easy for me to get up out of this chair. It's easy for me to walk, longer than 1 mile. So it's about, being consistent, thinking about the long-term goal that you have, and that's a quality life as you get older.
Yeah, it is.
No disease.
Yeah. And it's hard to sometimes get started, right? And that's why I would tell patients, hey, if you're in an area where you can walk outside, because one of the other parts of decreasing stress is decreasing heart disease is your stress, right? And so being active and going outside can help reduce your stress. But being consistent is really key. And it's when you lose the motivation, right, you still have to be consistent. And that could be 10 minutes 3 times a day, because it's still 30 minutes. And I would tell patients that all the time. If you are just getting started and you can't do 30 minutes, just physically, do a 10-minute walk, right? Just get up and be active for 10 minutes and then do it another 10 minutes later, in another hour, or do it in the evening. But be consistent with it, because we know that's going to help lower your weight and your blood pressure.
I can remember being hospitalized when I was going through my cancer journey because my hemoglobin was low and I had to get a blood transfusion. And I remember the doctor asking me, like, what do you do as far as exercise? And even through my cancer journey, I would walk. Like, even when I was getting chemo, I would always walk. It was just something that was not really easy for me to do because of the fatigue, but it was something that I continued to be consistent about. And I believe that because of that, I didn't have as many issues as some of the other cancer survivors had going through my cancer journey, is because I continued to exercise throughout my cancer journey, and it helped.
And when I talk to oncologists, they say that part of your treatment is a healthy lifestyle and being active and exercising.
Yes. Kenya said she agreed with the consistency. She said consistency is everything. And Tracy said this is good. It's good.
Yeah, share the information. Mm-hmm.
Yes, please share this information with individuals, because we know if this is the #1 killer in the US and worldwide, then you know someone who is dealing with heart disease. Doc, and I wanted to mention that I read somewhere that sometimes it says it's the silent killer, because sometimes you don't know until you have something happen that's related to heart disease.
And that's so key. I'll go back to my mother's story, right? So when she was diagnosed in 2013, I remember in 2012, we went on a vacation, and she couldn't walk very far. And this is a woman who would just go and walk all the time. And we know that it didn't start when those symptoms started, right? There was a buildup of blockages and things that were going on for years and years. But when she started to have symptoms, that's when we sort of started to do the workup. And she had her the stress test, which was abnormal, and then they did an angiogram. And that angiogram through the groin that shows exactly where the blockages are. The cardiologist called me while I was at work and said, your mother has a 99% blockage in the left main artery of her heart. He said it's a miracle that she's walking around, and she should not go home. And they actually took her for surgery that night or the next day, but she didn't leave after that surgery. After the surgery. But the point is that 99% blockage was going on it was building, right? And so it can be a silent killer until it becomes, symptomatic. And that's why it's also very important to do a lot of these lifestyle things for your whole life, even though you feel healthy and you're doing all the right things. This is important, right? And we always talk about advocating for yourself. When you go to the doctor, make sure, and you should be going to the doctor at least annually based on your medical conditions, to get your blood pressure checked, get your cholesterol checked, and all of those things to help.
Yes, I have people that make comments to me like, because I go to the gym a lot. So they'll say, while you're exercising, you're already thin. Like, what's the purpose of you going to the gym? And I'm like, it's not about me losing weight. It's about me being healthy. It's about me, just maintaining what I have. And also, I know that, exercise can cut down diabetes, it can cut down high blood pressure, all these different things. It can reduce it. It's not just about, oh, you're exercising, you're already thin. Thin doesn't equal healthy. So let's just say that. We know obesity doesn't equal healthy either, but thin doesn't necessarily mean that you're healthy either. So I exercise to not only just to maintain, but also to make sure that I'm reducing my risk, because type 2 diabetes run in my family. I don't want to get type 2 diabetes. So what I can do is I can exercise, I can eat right, and make sure that I'm doing everything I can to reduce it. That doesn't mean that I'm not going to get type 2 diabetes, because I can very well still get it, even though I'm doing all of these things. But I know that I'm being proactive about it. And if it happens, I'd be like, oh, okay, it was just meant to happen because I was doing all of those things to prevent it.
Yeah, you made some great points there, right? Not because you're thin means that a person is automatically healthy. We can't assume that, right? But again, we're not exercising just for weight loss because there's many people who have illnesses and may have a normal BMI, body mass index, right? So you're doing it for all those other things that we know exercise does in decreasing the inflammation in your body, in decreasing your blood pressure, in giving you energy, increasing the blood flow. All of those things are the reasons to exercise. And, as we get older, even, it's not about doing these strenuous, hard activities. It's about being active and doing what you can, is where I started, right? We're learning more about just walking and walking outside like you did when you had cancer. So important. Don't get discouraged by thinking, oh my gosh, I don't want to do all of what I see folks doing, right? Just get moving, just move. We don't really talk about that, the movement piece in your day, in just not sitting, especially with the pandemic and everybody working from home. Get a sit to stand desk if you can, or just stand and walk intermittently.
And I think you brought up a good point that not watching everybody else, it can be discouraging, like looking at everybody else, like maybe post on Facebook that they're working out and they're doing this type of diet and they're losing weight. So it could be discouraging if you're watching or comparing yourself to someone else. And I would say don't. Like Doc Michelle said, start wherever you are, start there, and then you're just going to build on as you be consistent.
Yes, yes.
I want to talk about, go ahead.
Yeah, the excessive stress. I was going to go to that, or even nutrition, but you're absolutely right. Yep. The stress we live under, right? I mean, if we just think about the last 3 years, right? This chronic stress. So when we think about stress, we think about chronic stress, or is it what we call an acute stress of, oh, I was just in a car accident. That's stressful too, right? Your blood pressure goes up, but then it probably will come down, right? But it's the chronic daily stress that we live under, the financial stress, housing inequality, the news stress, and just hearing, about everything that's going on, the pandemic, all of those chronic stresses, it increases the certain stress hormones in your body, epinephrine, there are different chemicals, cortisol, all of that then increases the inflammation and the blood pressure, right? And so when we talk about reducing your stress, it really is like an active process to do that, right? Because the stresses that come in, environmental toxins, and all the things that we are bombarded with on a daily basis, it does take some active plan to decrease that. And some of that is the movement, some of that is I'm going to get an app and meditate for 5 minutes and just deep breathe and pay attention to my breathing. Some of that is, when we talk about the environmental stresses to our body, is are we exposing ourselves to toxins when we don't need to in our homes, and using green products. And we think about all of those different types of stress that over time, the chronic stress that we live under can cause the blood pressure to increase. And over the pandemic, when we were under all of this stress and people weren't really going to the doctor as much as they needed to, we're now seeing some of those effects, right? With people coming in with high blood pressure, and now they're getting diagnosed with heart disease and things like that. But that's an important piece to stress about stress, is if you're feeling stressed, tense in your neck, just always worried or anxious, depression, all of those are signs of stress. It does take not only recognizing it, but being active in reducing it, right? It's not just going to go away. It's recognizing it and figuring out, okay, what can I do to decrease that? Is it going to therapy if I'm depressed or anxious? Is it trying to get that walk in? And studies show that walking outdoors is better than walking indoors. Being in nature reduces your stress, right? If you've got a safe space outside to walk, walking on your treadmill is great in the winter when we don't want to really go outside. But once the spring comes and once the weather is nice and you feel comfortable getting outside, walk outside, take a friend with you, all of those things, being around people. When we were going through the pandemic and we were away from people, that was a stress, right? So using all of those tools to decrease your stress, because stress increases blood pressure, increases the stress hormones, which then leads to heart disease, either in the form of a heart attack, or we talked about heart failure when the high blood pressure causes the heart to work harder over time. Then you get that big floppy heart that's not working very well.
Before we get into the nutritional portion of it, I wanted to talk about the lack of quality of sleep, because I know this is something that I am just not good about. I'm not consistent about doing.
Well, a lot of us, right, if we are busy, the first thing we'll give up is sleep, right? We're like, oh, I've got to get this assignment done. I got to do this, that, and the other. And so we don't get the sleep for a number of reasons. Doing a lot, or when you try to sleep, you're not getting good quality. You're not staying asleep. You can't fall asleep effectively. And we also know that the lack of quality sleep increases your cortisol levels, which is a stress hormone. We know that people who work nights, the night shift, right, they usually are not getting good quality sleep, which then increases their cortisol level, which can increase their risk of high blood pressure, obesity, and then all the things that come from that. So I encourage people that, turn off the TV, figure out how you can get 7 to 8 hours of sleep a night. If that's going to mean turning off the TV, but sometimes people can't usually go from 4 or 5 hours to 8 hours, right? Your body's not used to it. So we talk about increasing that by a half hour, maybe every week or so, right? So if you usually go to bed at midnight, try to go to bed at 11:30 this week, right? And then you work up to 11. And over time, you will train your body to get that rest, because even though we don't think about it and we make it the first thing we give up when we've got a lot to do. So that's part of it. And then the other part is, if you're not getting good, adequate sleep, you can't stay asleep, right? So there's lots of reasons for that. Is it because you have a lot on your mind? There's anxiety, you worry. Meditation definitely helps. We also tell people to get off of their phones and devices, because that blue light is stimulatory to the brain, and then it can't shut down when it needs to. And then using what we call white noise, like sometimes your phone, if you play it, it has rain or the sounds of a vacuum. That white noise can help you fall asleep. Yeah, and the TV.
Yeah, Ruben said the TV is definitely a problem for him.
Yeah. Some people, we know people that will go to sleep, right, with their TV on and keep it on all night. And that's not getting you good sleep either, because subliminally the noise and that's getting into your brain.
I think it literally takes me probably a couple of minutes to fall asleep, because normally I go to sleep when I'm tired. I hit the bed and I'm tired. So when I hit the bed, I don't really, my mind don't have time to race or do any of those things. My body's just, I'm just out of there. If for some reason I have trouble sleeping, I normally will listen to like maybe Bible scriptures, or I will listen to some nighttime meditation or something, maybe like water or just something to help me, fall asleep.
Yeah. But I think it was Ruben said the TV is a big thing, right? Because now we've got 24/7 television. You know, when we were younger, the TV went off at a certain time, but now it's 24/7 in our brains, on our phones. We've always got access, and so the brain is on this continual stimulation. And sometimes we have to remove that and remove it. Um, at least an hour before bed. We think also when we go back to exercise that mild exercise, at least an hour prior to your bedtime, can help you fall asleep. Nothing too strenuous. If you're doing an evening exercise class that really is strenuous, it could make you not be able to sleep. But a gentle walk at night, something like that, a warm bath at night, that can help you fall asleep. Yeah, the Netflix too, Ruben. All of that. It's 24/7. We're streaming the shows for 8 hours. So, and binge watching. So we have to just shut it down, right? Because it's a healthy lifestyle we're talking about, right? And that is part of that is sleep. Part of it is reducing your stress. Part of that is activity. And it's just what we call a healthy lifestyle for the rest of your life.
So part of that we know has to do with nutrition. And I heard Dr. Oz say that when you walk into a grocery store, that it's really you're walking into a pharmacy.
Yeah. I mean, really, when you go to the grocery store, if you think about how a grocery store is set up, first of all, right? The healthy, the greens and the fruits are on the outside, right? Before you get to those inner aisles. So I always tell patients, shop on the outer part of the grocery store, okay? Because if you're spending all your time on the inner part, right, you're getting processed foods and so forth, right? But it really is the important good foods are those green leafy vegetables, your fruits. They're usually right when you go into the grocery store and not in the inner aisles, because we know that if you have a plant-based diet full of nuts and things that grow from the ground, and vegetables and fruits and your beans and all of that, your risk of heart disease decreases. There was a study years ago where they looked at patients who they would do an angiogram on, where they could see the blockages, right? Because they shoot the dye in, they light up the heart. And they looked at those who had heart disease, and then they gave them a strict plant-based diet for 6 months to 12 months. And after that time, they could see decrease in the blockages. And in a few of those patients, the blockages were gone. But it was really a strict plant-based. There was no, meats and red meats and all of that. And so what we know that is you can, and I forget the name of the book. It's Reversing Heart Disease. That's the study I'm talking about, and I'll have to put it on my Facebook. But it's a great book, and it really talked about how you can reverse heart disease, but it really does take a lot of these lifestyle changes and a strict plant-based diet. If you are interested in the best diet, the best foods, I talk about the Mediterranean diet. That's the one, right? That is best for your heart. And it encompasses plant-based vegetables, fruits, your beans, so any of those, the beans, the chickpeas, the black-eyed peas, the things that are good for you, whole grains, healthy oils, your avocado oils, your olive oil, all of those things, and help your heart. And so if anyone ever asks me what diet, I'm always going to refer them to the Mediterranean diet. There's lots of resources out there. The Mayo Clinic, Cleveland Clinic, they all have information on it where you can print out all the things that are allowed on that diet, and start incorporating that when you go to the grocery store. The fatty fishes, your salmon, sardines. People don't think sardines. We don't. My mother loves sardines. I love sardines. I love salmon. I'll be having that for dinner. Um, but it all helps because they're rich in those omega-3 fatty acids, and it helps to fight inflammation in your body. And so that's you always ask me, what's the one takeaway? One of the big takeaways of this is that diet and incorporating those healthy fats, the plants, the nuts, and things like that.
So my question is, and I know this is not directed towards you because I know that you're all about how to do things from a natural and a healthy way. Why don't most doctors say, hey, why don't you try this type of diet before we put you on some type of lifelong medication with all of these side effects and see how this goes for you? Versus, putting a Band-Aid on it. Let's get to the root cause of why I'm having all these issues in the first place.
Mm-hmm. Well, so when a doctor is seeing you, we're looking at all the risks that you have. And for me, right, I'm going to say, well, I want you to do this diet, but I also think you could benefit from this medication. And I want you to do both. And let's get your cholesterol down. And I have done this before with some patients. I'll say, hey, because I know the medications can be helpful but they do have side effects. Let's try the meds. Let's say give you 60 to 90 days on it, and then we can stop it. And in that time, you would have incorporated the diet. And if you're able to maintain your cholesterol on your own with that Mediterranean diet and lifestyle changes, good. And there's some patients, I always say that in order for a patient to do what I'm recommending, they have to want to do it, right? And have buy-in and understand, right? So and I've had patients tell me, doc, I really don't want to be on that medication. I'm going to try it. And I will say, okay, we'll give you a trial. I want you to work on it for the next 60 to 90 days. And when you come back, we'll recheck your numbers. And I hope that they're getting down. Here's the information. I always, give them the information on the diet plan and give them the resources. And if they're able to do it on their own, great. If not, any way we can get the cholesterol down is important, right? Because we don't want you to walk around with high cholesterol. And we know that for some people, doing those lifestyle changes can be very difficult. And it's a slower process because if you've done something one way your whole life, it's really hard, right? It's like the quitting smoking. You may want to do it, but it's so hard. It takes multiple tries. So it's a balance. It's a balance, right? We know, hey, the pharmaceuticals industry is a multi-billion-dollar industry for a reason. People are sometimes looking for a quick fix versus the healthy lifestyle changes. And when we look at your overall health and picture and what your risks are, from a doctor standpoint, how do we reduce your risk as quickly as possible while you work on your lifestyle? Not because we start you on a medicine means that medication is for life, right?
Ruben brings up a great point. He says very few doctors will take you off medicine unless you give them a reason why you don't need it.
Yeah, that could be true. I say that if someone shows me that they've done the lifestyle changes, and let's say you're on blood pressure medicine, right? If you've done the lifestyle changes, we'll see that the blood pressure is improving, and maybe we decrease your dose from 10 milligrams to 5. And see if that blood pressure is still doing great and you're exercising, you're walking, you've incorporated things. There's times where we will take patients off of medications, but it certainly is, it's a conversation that you have to have with your patient and your provider. Because we don't want to stop any medications abruptly, because you can have a bump in your blood pressure, right? If you're on a medication and you just stop it, you can have a rebound high blood pressure and other issues that come from that. So always discuss with your provider. Your provider should be listening to you and having a collaborative relationship with you. But it's a two-way street, right? You've also got to incorporate all the other things, changes.
So what I'm hearing you say is that we do have a say so, and we're able to play a part in our health when we go to the doctor and we are wanting to get our blood pressure down, or we're wanting to reduce our risk of diabetes and heart disease. We could come to the doctor with a plan and say, hey, I want to start the Mediterranean diet and I'm going to start exercising. Can we just hold off on the medicine just to see how I do for 3 months, and then we can reevaluate where we go from there?
Yeah, you can always have a conversation with your provider. It depends on where your numbers are and how severe your blood pressure is, right? Because the lifestyle changes can is a gradual decrease in the numbers, whereas with medication, right, within a day or two, we'll see the blood pressure respond less than. And so it all depends on what your risks are, where your numbers are, and you having that conversation with your provider as well. I'll tell you, I've had patients who they have high blood pressure, like, nope, I don't want that medicine. And I'm like, oh my goodness, but okay, okay. If you accept the risk, here's what you can do.
And this is why we don't like to say diet. We always say lifestyle changes, because we know it's not something that happens overnight. We know it's going to come with consistency. It's going to come with hard work before you really see those changes take place in your body.
Yeah.
So I wanted to give out Doc Michelle, because this was in one of the articles that you sent to me as we were doing our research for the show today, and it had a link in there. It says, if you are between the ages of 40 and 75 years old and you have never had a heart attack or a stroke, you can go to Check Change Control calculator, and it estimates your risk of having a cardiovascular event within the next 10 years coming up. So you can take this link and they're going to take some information from you, and then it's going to assess your risk and let you know. And then you know what type of things you need to incorporate changes in your life so that you won't have to worry about, having any type of heart disease episode.
Yeah. And thanks for bringing that up, because knowledge is key. Sometimes we walk around and we think we're just fine, right? But when we plug in the numbers, if you plug in your age and what your blood pressure is that you know it to be, and hopefully you've had your cholesterol checked and what your BMI is, and you plug in all these things, and the calculation will give you a risk score, then it can be eye-opening, to see those numbers, that objective sort of information.
Yes. Dr. Michelle, as we wrap up the show right now, thank you so much, first of all, for just lending us your expertise and just always being willing to educate the listeners. I appreciate you very much. And every time that you come on to drop some gems. So thank you so much for that.
Thank you for having me. This is, like I said, a topic that's close to my heart.
Can you please just give some words of wisdom as it relates to heart disease and how we can feel empowered?
Yes. So as we started off saying, right, it is the leading cause of death in the US and in the world, but there is so much that we can do to decrease our risk, right? There's certain things we can't change, like our age, our sex, family history, but there's so much that you can. Number one, if you smoke, quit, talk to your provider. We have a lot of tools in our toolbox that can help you. If you are inactive, get active. If that's walking, if that is gardening, if that's just, getting up and moving, if you work from home, get active and reduce your stress, right? We've lived in the last 3 years in increased excessive stress. And so it really takes being active and intentional about reducing your stress. And some of that comes with exercising, meditation, getting together with friends and family, if they're not stressing you, getting together with friends and doing things that we enjoy. And then that last piece is the nutrition piece, which is key for so many things. The Mediterranean diet. If you're not familiar with all the things that we discussed that are in that, you can Google that. Mayo Clinic, Cleveland Clinic, they all have great information about what to include in your Mediterranean diet. And then the last piece is be a health advocate for yourself. Have good conversation with your provider about what are your risks and what you want to do to lower them.
Awesome. Thank you so much, Dr. Michelle. I appreciate you.
Thank you for having me.
You're so welcome. All right, you guys, coming up next at 7 p.m. right here on Intellectual Radio is The People Show with Mark Wallace and Charles Thomas. So don't go anywhere. Join me next Monday right here on Intellectual Radio at 6 p.m. Central Standard Time. I will leave you with these words of wisdom. Let your food be your medicine and your medicine be your food. As always, thank you for tuning in to Warriors Talk with author and founder Lady ReShell, where we are changing lives one warrior at a time.
Thank you for listening to this week's edition of Warriors Talk with Lady ReShell. To find out more about Warriors Talk, follow at Warriors Talk, the number 1, on all social media outlets, and Warriors Talk with Lady ReShell on YouTube. Please join us next week and every Monday evening at 6 p.m. Central Standard Time on intellectualradio.com for Warriors Talk with Lady ReShell, where we encourage, educate, and empower you into action.